The member from Waterloo.
Very much, and a pleasure to join the debate here this afternoon. I'm bringing the voices and the stories of two families to the floor of this legislature. Caitlin Roth, who died by suicide in 2022. The help was not there when she asked for it. And Jackie McDermott, who also died by suicide because the help was not there. Wasn't affordable, wasn't accessible, wasn't there, just absent, Speaker. I've been working with both of these young women's parents who are working so hard to turn their grief into advocacy. And they're watching here today. They want to see a response from this government that would prevent future parents from going through this kind of pain and this kind of anguish, Speaker. The waitlist data from Ontario alone in 2020 found that the average wait time for counselling and therapy was 67 days. That was in 2020. In some cases, wait times for intensive treatments are now up to 2.5 years. While researchers called this essentially irrelevant, there's no help. There's no help when you have the courage to ask. There's no help or assistance when you actually have to struggle to get through a day. There's no help or assistance for parents who are watching their children and waiting for them to self-harm or for them to not be here anymore. So, Speaker, we have an opportunity here as legislators. This is why we get elected. This is why we come to this place. This is what our communities want. They want leadership on mental health. This is a motion that you can say yes to today. It would be the right thing to do. You would be applauded for doing so. And then we could get together as legislators working across the aisle to make sure that mental health is a priority. The cost to our economy is one thing, and the research is profound on this. The return on investment for ensuring that people have access to timely, accessible, and trauma-informed mental health services is exponential. Let's do the right thing today. Let's start off this legislature in a spirit of camaraderie in keeping people alive, because it is definitely worth fighting for, Speaker.